Common infectious diseases. Many childhood diseases can be prevented through vaccination. A vaccine stimulates the body to develop specific defensive mechanisms. Vaccines are divided into 4 general classes: those containing living infectious organisms, which are either disabled or otherwise non-virulent strains; those containing infectious agents killed by physical or chemical means; those containing solutions of toxins from microorganisms that may be used directly, but that are usually treated to neutralize their toxic potential; and those containing substances extracted from a portion of an infectious agent. Starting in the 1920s, diphtheria rates dropped quickly in the United States and other countries with the widespread use of vaccinations. In the past decade, there were less than 5 cases of diphtheria in the United States reported to the CDC, or Center for Disease Control. However, the disease continues to cause illness globally. In 2016, countries reported about 7,100 cases of diphtheria to the World Health Organization, but there are likely many more cases that actually happened. Diphtheria is an infection caused by bacteria. It spreads or transmits from one person to another person, usually through respiratory droplets, like from coughing or sneezing. Rarely, people can get sick from touching open sores or skin lesions, or clothes that touch open sores of someone who is sick with diphtheria. Another person can also get diphtheria by coming into contact with an object, like a toy, that has the bacteria that causes diphtheria on it. The characteristic symptoms of diphtheria include a thick, patchy, gray, blue, or white membrane that forms over the mucous membranes of the pharynx, larynx, tonsils, soft palate, and nose. This is a picture of a child with a swollen neck due to diphtheria infection. Bacteria that causes diphtheria can get into and attach to the lining of the respiratory system, which includes part of the body that helps you breathe. When this happens, the bacteria can produce a poison or toxin that causes weakness, sore throat, fever, and swollen glands in the neck. The poison destroys healthy tissues in the respiratory system. Within 2 to 3 days, the dead tissue forms a thick, gray coating that can build up in the throat or nose. Medical experts call this thick gray coating a pseudomembrane. It can cover tissue in the nose, tonsils, voice box, and throat, making it very hard to breathe and even swallow. The poison may also get into the bloodstream and cause damage to the heart, nerves, and kidneys. Complications from diphtheria may include blocking of the airway, damage to the heart muscle, known as myocarditis, nerve damage, called polyneuropathy, loss of the ability to move, paralysis, lung infection, including respiratory failure or pneumonia, and for some people, diphtheria can even lead to death. Even with treatment, about 1 in 10 diphtheria patients will die. Without treatment, about half of the patients can die from the disease. Tetanus, or lockjaw, occurs as a result of a bacterial infection. The tetanus grows in the absence of oxygen in the soil, dust, feces, and saliva. We can come into contact with tetanus through puncture wounds, lacerations, or burns, or even from contaminated injections such as intravenous drug use. Some of the signs and symptoms include abdominal rigidity followed by painful contractions, primarily of the masseter or cheek muscles and the neck muscles. The jaw becomes rigidly flexed, hence the lockjaw name. The voice becomes altered and facial muscles contract. Additional signs and symptoms include fever, tachycardia and high blood pressure, muscle spasms, locked jaw, sweating, and difficulty swallowing. The management for wounds should follow standard procedures, including flushing the area with water, washing with soap, and monitoring for signs and symptoms of infection. If you receive a cut and suspect the potential for tetanus, a booster shot can be given within the first 72 hours of injury. A booster shot may also be given for injuries if the previous vaccination shot or booster shot is more than 5 years old. Whooping cough is an infectious bacterial illness that affects the respiratory passages. It was first described in the 1640s. Whooping cough got its name due to the spasms of coughing that are punctuated by a characteristic high-pitched whoop sound when the child inhales deeply after a coughing spell. Whooping cough is one of the most common vaccine-preventable infectious diseases among children younger than 5 years of age in the United States. Whooping cough is another name for pertussis. It is the P in the familiar DTaP, diphtheria, tetanus, and pertussis vaccination combination inoculation routinely given to children, and the P in the Tdap given to adults and adolescents. Despite the widespread use of pertussis vaccinations, whooping cough has made a comeback in recent years, making this easy to prevent infectious disease one of the leading causes of illness and death. The incubation period for whooping cough is 7 to 10 days. The course of whooping cough follows through 3 stages. The first stage of whooping cough is the catarrhal, or runny nose stage. This phase typically lasts for 1 to 2 weeks. Symptoms during this phase resemble that of an upper respiratory illness or common cold, including a runny nose, nasal congestion, sneezing, and an occasional cough. A low-grade fever may be present in some cases, but it is only during this stage that antibiotics can halt the progression of whooping cough. The second stage of whooping cough is a paroxysmal stage. The duration of this phase is highly variable, lasting from 1 to 10 weeks. Intense and drawn-out bouts of coughing characterize this phase. The attacks tend to be more frequent at night, with an average of 15 attacks in a 24-hour period. Often people can hear a high-pitched whoop caused by the gasping person inhaling between coughs. Barking coughs usually indicate a viral infection and are non-indicative of whooping cough. Newborn babies and infants in particular may appear to stop breathing and will perhaps turn blue during the coughing spasm. Vomiting or choking is also common during this stage as well. The third stage of whooping cough is the convalescent stage. This can last for weeks or months, and a chronic cough that becomes less proximal, fewer sudden outbursts of coughing in nature characterize this stage. The flu is a contagious respiratory illness caused by the influenza virus that infects the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. The best way to prevent the flu is by getting a flu vaccine every year. Most experts believe that the flu virus spreads mainly by tiny droplets made when people with the flu cough, sneeze, or talk. These droplets can land in the mouth or the nose of people who are nearby. Less often, a person might get the flu by touching a surface or object that has the flu virus on it and then touching their own mouth, nose, or possibly their eyes. A 2018 CDC study looked at the percentage of the U.S. population who were sickened by the flu using 2 different methods and compared the findings. Both methods had similar findings, which suggested on average about 8% of the United States population gets sick from the flu each season, with a range between 3% and 11% depending on the season. Signs and symptoms of the flu are different from a cold, as it usually comes on suddenly. People who are sick with the flu often feel some or all of these symptoms: fever or feeling feverish or chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headache, fatigue or tiredness, and some people may have vomiting or diarrhea, though this is more common in children than adults. Polio, or poliomyelitis, is a crippling and potentially deadly infectious disease. It is caused by the polio virus. The virus spreads from person to person and can invade an infectious person's brain and spinal cord, causing paralysis, meaning they cannot move parts of their body. Most people who get infected with the polio virus, about 72 out of 100, will not have any visible symptoms. About 1 in 4 people with the polio virus infection will have flu-like symptoms that may include a sore throat, fever, tiredness, nausea, headache, and stomach pain. These symptoms usually last 2 to 5 days and then go away on their own. A smaller proportion of the people with the polio virus infection will develop other more serious symptoms that affect the brain and spinal cord, including paresthesia, the feeling of pins and needles in the legs, meningitis, which is an infection of the covering of the spinal cord and/or the brain, and it occurs in about 1 in 25 people with the polio virus infection. Paralysis, which means they cannot move parts of their body, or weakness in the arms, legs, or both, and occurs in about 1 out of 200 people with a polio virus infection. Paralysis is the most severe symptom associated with polio because it can lead up to permanent disability and even death. Between 2 and 10 out of 100 people who have paralysis from the polio virus infection die because the virus affects the muscles that help them breathe. Even children who seem to fully recover can develop new muscle pain, weakness, or even paralysis as adults, anywhere from 15 to even 40 years later. This is called post-polio syndrome. The polio virus is very contagious and spreads through person-to-person contact. The virus lives in an infected person's throat and intestines. It enters the body through the mouth and spreads through contact with the feces or poop of the infected person, and though less common, through droplets from a sneeze or cough. An infected person may spread the virus to others immediately before or about 1 to 2 weeks after symptoms appear. The virus can live in an infected person's feces for many weeks. It can contaminate food or water in unsanitary conditions. People who do not have symptoms can still pass the virus on to others and make them sick. The polio vaccination protects children by preparing their bodies to help fight the polio virus. Almost all children, 99 children out of 100, who get all recommended doses of the vaccination will be protected from polio. There are 2 types of vaccination that can prevent polio: inactivated poliovirus vaccine and an oral poliovirus vaccination. Only the inactivated poliovirus vaccination has been used in the United States since 2000. The oral poliovirus vaccination is still used throughout much of the rest of the world. Chickenpox is an infection caused by the varicella zoster virus. It causes an itchy rash with small fluid-filled blisters. Chickenpox is highly contagious to people who have not had the disease or have not been vaccinated against it. Today, a vaccination is available that protects children against chickenpox. Routine vaccination is recommended by the CDC. Signs and symptoms of chickenpox include itchy blisters and a rash caused by chickenpox infection, and it appears 10 to 21 days after exposure to the virus. It will usually last about 5 to 10 days. Other signs and symptoms which may appear 1 to 2 days before the rash include fever, loss of appetite, headache, and tiredness or a general feeling of being unwell or malaise. Once the chickenpox rash appears, it goes through 3 phases: raised pink or red bumps or papules, which break out over several days; small fluid-filled blisters or vesicles, which form in about 1 day, then break open and leak; crusts and scabs, which cover the broken blisters and take several more days to heal. New bumps continue to appear for several days, so you may have all 3 stages of the rash, the bumps, the blisters, and the scab lesions, all at the same time. You can spread the virus to other people for up to 48 hours before the rash appears, and the virus remains contagious until all broken blisters have crusted over. The disease is generally mild in healthy children. In severe cases, the rash can cover the entire body, and lesions may form in the throat, eyes, and mucous membranes of the urethra, anus, and even the vagina. Mumps is a viral infection that primarily affects saliva-producing or salivary glands that are located near your ears. Mumps can cause swelling in one or both of these glands. Mumps was common in the United States until a mumps vaccination became routine. Since then, the number of cases has dropped dramatically. However, mumps outbreaks still occur in the United States, and the number of cases has crept up in recent years. These outbreaks generally affect people who are not vaccinated and occur in close contact settings such as schools or college campuses. Complications of mumps, such as hearing loss, are potentially serious but are rare. There is no specific treatment for mumps. Some people infected with the mumps virus have either no signs or symptoms or very mild ones. When signs and symptoms do develop, they usually appear about 2 to 3 weeks after exposure to the virus. The primary sign of mumps is swollen salivary glands that cause the cheeks to puff out. Other signs and symptoms may include pain in the swollen salivary glands on one or both sides of your face, pain while chewing or swallowing, fever, headache, muscle aches, weakness and fatigue, and loss of appetite. Mumps is highly contagious for about 9 days after the symptoms appear. Mumps is caused by a virus that spreads easily from person to person through infected saliva. If you are not immune, you can contract mumps by breathing in saliva droplets from an infected person who has just sneezed or even coughed, or if they're talking closely to you. You can also contract mumps from sharing utensils or cups with someone who has mumps. Measles is a childhood infection caused by a virus. Once quite common, measles can almost always be prevented with a vaccination. Measles can be serious and even fatal for small children. While death rates have been falling worldwide as more children receive the measles vaccine, the disease still kills more than 100,000 people per year, most under the age of 5. As a result of the high vaccination rates in general, measles has not been widespread in the United States for more than a decade. The United States averaged about 60 cases of measles a year from 2000 to 2010, but that average number has been constantly jumping up since. Most of these cases originate outside of the country and occur in people who are unvaccinated or who did not know whether or not they had been vaccinated. Measles signs and symptoms appear about 10 to 14 days after exposure to the virus. Signs and symptoms of measles typically include fever, dry cough, runny nose, sore throat, inflamed eyes or conjunctivitis, and tiny white spots with bluish-white centers on a red background found inside the mouth on the inner lining of the cheek. The skin rash is made up of large, flat blotches that often flow into one another. The infection occurs in sequential stages over a period of 2 to 3 weeks. The infection or incubation stage. For the first 10 to 14 days after you're infected, the measles virus incubates. You have no signs or symptoms of measles during this time. Measles typically begins with a mild to moderate fever, often accompanied by a persistent cough, runny nose, inflamed eyes, and a sore throat. This relatively mild illness may last 2 to 3 days. The acute illness and rash. The rash consists of small red spots, some of which are slightly raised. The spots or bumps are in tight clusters and give the skin a splotchy red appearance, and the face breaks out first. Over the next few days, the rash spreads down the arms and the trunk, and then over the thighs, lower legs, and feet. At the same time, the fever rises sharply, often as high as 104 to 106 degrees Fahrenheit. The measles rash gradually recedes, fading first from the face and last from the thighs and feet. A communicable period occurs when a person with the measles can spread the virus to others for about 8 days, starting 4 days before the rash appears and ending when the rash has been present for 4 days. As of June 3rd of 2019, there are 981 cases of measles reported in the United States by the Centers for Disease Control. The occurrences are largely linked to travelers who return from countries with large measles outbreaks. German measles, also known as rubella, is a viral infection that causes a red rash on the body. Aside from the rash, people with German measles usually have a fever and swollen lymph nodes. The infection can spread from person to person through contact with droplets from an infected person's sneeze or cough. This means that you can get German measles if you touch your mouth, nose, or eyes after touching something that droplets from an infected person have on it. German measles is rare in the United States. With the introduction of the rubella vaccination in the late 1960s, the incidence of German measles has significantly declined. However, the condition is still common in many other parts of the world. It mainly affects children, more commonly those between 5 and 9 years of age, but can also occur in adults. German measles is typically a mild infection that goes away within 1 week, even without treatment. The symptoms of German measles are often so mild that they are difficult to notice. When symptoms do occur, they usually develop within 2 to 3 weeks after the initial exposure to the virus. They often last about 3 to 7 days and may include pink or red rash that begins on the face and then spreads downward to the rest of the body, mild fever, usually under 102 degrees Fahrenheit, swollen and tender lymph nodes, runny or stuffy nose, headache, muscle pain, and inflamed or red eyes. German measles is typically a mild infection that goes away within 1 week, even without treatment. However, it can be a serious condition in pregnant women as it may cause congenital rubella syndrome in the fetus. Congenital rubella syndrome can disrupt the development of the baby and cause serious birth defects such as heart abnormalities, deafness, and brain damage. It is important to get treatment right away if you are pregnant and suspect that you have German measles. To avoid complications during pregnancy, many women who become pregnant are given a blood test to confirm immunity to rubella. It is important to contact your doctor immediately if you've never received the vaccination and think you might have been exposed to rubella. Mononucleosis is an infectious illness that's sometimes called mono or the kissing disease. While you can get the virus that causes it through kissing, you can also get it in other ways, like sharing drinks or utensils. It is contagious, but you are less likely to catch mono than other illnesses like the common cold. Mono usually is not a serious illness, but it can lead to complications that in some cases make the disease more dangerous. The symptoms of mono can be mild, but they can also become very severe. If severe complications develop, you may not be able to take part in your normal daily activities for several weeks. In general, the Epstein-Barr virus is what causes mono. It is a common virus that many people are exposed to as kids, but even if you are exposed to the Epstein-Barr virus, it is not guaranteed that you will get mono. It is possible to be infected with the Epstein-Barr virus and carry it in your body for your entire life without ever having the symptoms of mono. The Epstein-Barr virus is part of the herpes virus family. It is one of the most common viruses you can get. Most people get infected with it at some point during their lives, and people all over the world will get it. In the United States, about 85 to 90% of adults are infected with the virus by the time they're age 40. Usually the infection happens before a child becomes a teen. The Epstein-Barr virus is the most common cause of mono, but other viruses may cause it as well. Epstein-Barr virus spreads through bodily fluids. The most common way you can spread it is through saliva, which is why you can get it from kissing. You can also get it if you share food, drinks, or silverware with a person who has it, or if an infected person coughs or sneezes near you. The Epstein-Barr virus can also spread through blood and semen, so although it is less likely, you can also get mono from a medical procedure such as a blood transfusion and organ transplants, or through sexual contact. If you develop complications from mono, they can be very serious. One problem that can happen is an enlarged spleen. If it becomes severe, your spleen can rupture and cause sudden sharp pain on the left side of your upper abdomen. If you have pain like this, then it is considered a medical emergency. Get medical care right away because you may need surgery. Mono can also cause complications that affect your liver, including hepatitis or jaundice. It is less likely, but mono can also cause problems with your heart and nervous system and also result in anemia. Mono may affect individuals' sport participation. Individuals diagnosed with mono should not participate in any contact or collision sport because of the potential for rupture due to an enlarged spleen. If the spleen and the liver are normal, limited physical training is allowed for 3 weeks after the illness onset. Strenuous exercise and return to contact sports can occur after another 1 to 2 weeks. Viral meningitis is an infection of the meninges, a thin layer covering the brain and spinal cord, by any one of a number of different viruses. It is a fairly common disease. We see approximately 500 to 700 cases that are reported each year. It is a fairly common disease. Almost all cases of mono occur as single isolated events, and outbreaks are rare. Approximately half of the cases of viral meningitis are due to common enterovirus or an intestinal virus. Occasionally, children will have viral meningitis associated with mumps or a herpes infection. Mosquito-borne viruses also account for a few cases each year. In many cases, the specific virus cannot be identified. Because a number of different viruses are capable of causing viral meningitis, the manner in which the virus is spread depends upon the type of virus involved. Some are spread by person-to-person contact, while others can be spread by insects. The symptoms may include fever, headache, nausea and vomiting, neck pain and stiffness, called neutral rigidity, muscle pain, decreased coordination, malaise or fatigue, photophobia or sensitivity to light, and altered mental status. We should immediately refer these individuals to a physician to be examined. Symptoms generally appear within 1 week of exposure. No return to physical activity should be allowed for 2 to 3 weeks after the ease of symptoms. Warning: the next slides will demonstrate pictures of sexually transmitted diseases. This can be an uncomfortable topic for many individuals. The reasons why we are covering this topic is because they have an impact on an individual's health. It is important that you know the different types of sexually transmitted infections and how they may impact the well-being of an individual. There may be pictures of genitals on some of these slides to help us understand these conditions. The pictures are not meant to offend anyone, rather to inform us of these conditions. Research has suggested that 48% of the nearly 20 million cases of STDs occurring annually in Americans are acquired in people aged 15 to 24 years of age. Chlamydia is the most common bacterial STD in the United States. Chlamydia is the leading STD in college students with a reported incident rate of 10 to 20% annually. Unlike herpes and the human papillomavirus, chlamydia is highly preventable because transmission can be interrupted through the use of condoms. Chlamydia is easily treated with antibiotic therapy. In females, chlamydia often is asymptomatic and goes undiagnosed, leading to potentially dangerous health and fertility problems later. Some experts have suggested that chlamydia screening should become a routine part of an annual gynecological examination. In males, chlamydia causes mild itching and burning during urination. There may also be discharge from the penis. Gonorrhea is the second most common STD in the United States. It is characterized in males by a pungent, thick, milky yellow or greenish discharge and a burning sensation during urination. In women, the condition is often asymptomatic until it progresses to pelvic inflammatory disease. Genital sores are commonly caused by sexually transmitted infections, but they may also be the result of skin disorders or other infections. Genital herpes is an infection that causes outbreaks of blisters or ulcers on the genitals. Herpes, syphilis, and chancroids are the most common cause of genital sores in the United States. Your liver is the largest organ inside your body. It helps your body digest food, store energy, and remove poisons. Hepatitis is an inflammation of the liver. Viruses can cause most cases of hepatitis. There are 6 types, and each are caused by a different virus. The type of hepatitis is named for the virus that causes it, for example, hepatitis A, hepatitis B, or hepatitis C. Drug or alcohol use can also cause hepatitis. In other cases, your body mistakenly attacks healthy cells in the liver. Some forms of hepatitis are mild, and others can be more serious. Some can lead to scarring, called cirrhosis, or to liver cancer. Sometimes hepatitis goes away all by itself, and it does not need to be treated with drugs. Some hepatitises last for a lifetime. Vaccines can help prevent some viral forms of hepatitis. Many medical associations have suggested that a series of hepatitis B virus vaccinations should be administered during the first 18 months of life. Hepatitis B can be transmitted by blood, semen, vaginal secretions, and saliva. There is an incubation period of 60 to 150 days. The signs and symptoms of hepatitis B range from mild to severe. They usually appear in about 1 to 4 months after you've been infected, although you could see them as early as 2 weeks post-infection. Some people, usually young children, may not have any symptoms. When we do have signs and symptoms of hepatitis B, we typically see early mild flu-like symptoms, and then progressive symptoms, including severe fatigue, anorexia, nausea, vomiting, or diarrhea, muscle and joint pain, high fever, severe abdominal pain, and yellowing of the whites of the eyes, and a jaundiced appearance of the skin. The hepatitis B vaccination is typically given as 3 or 4 injections over 6 months. You cannot get hepatitis B from the vaccination. The hepatitis B vaccination is recommended for newborns, children and adolescents not vaccinated at birth. A prophylactic vaccination is required of an employer at no cost to an employee if the employee may be exposed to bloodborne pathogens as a result of their job. Acquired immunodeficiency syndrome results from infection with HIV, which falls within a special category called the retroviruses. An individual can be HIV positive and as such infected for years before any signs of AIDS appears. It attacks and destroys cells in the body's immune system, especially the helper T cells. It is transmitted via blood, semen, and vaginal secretions. To date, however, no documented cases of HIV transmission have occurred through participation in sports. Small amounts of blood stain on a uniform do not require the removal of the participant from a game or a uniform change. However, uniforms that become saturated with blood should be changed before returning to participation. The signs and symptoms include persistent fever and night sweats, unexplained weight loss and loss of appetite, extreme fatigue, white spots or unusual blemishes in the mouth, persistent dry cough unrelated to smoking, persistent unexplained diarrhea or bloody stools, easy bruising or atypical bleeding from any body opening, blotches or bumps on or under the skin, and persistent severe headaches. Even with all the information about AIDS, people are still confused on how we can get it. You can contract the HIV virus by participating in sex with someone without a condom if they are HIV positive. An HIV mother may pass the HIV virus to a baby during pregnancy. We can also contract HIV by sharing injected equipment with someone who is HIV positive, and also receiving contaminated blood transfusions or organ transplants. You cannot contract HIV from kissing, hugging, sharing food, having insect bites, using toilet seats, bathing, from someone sneezing or coughing around you, or by sweat droplets. Healthy HIV-positive athletes and those with AIDS may continue to participate in physical activity. The Americans with Disabilities Act of 1991 has said that individuals infected with the HIV virus cannot be discriminated against and may be excluded from participation only on sound medical grounds. The best defense for individuals is education. We need to learn about diseases and understand how they can be transmitted and how they can be prevented. In most cases, prevention is our key to stopping the spread of diseases.